The second type of training that I mentioned is resistance or strength training. And in fact, if I had to recommend anything to anyone, this would be the type of training. It's really important because if you think about how the body works, we have limited places to store carbohydrate that we eat in our diet. And most of that goes into our skeletal muscle. So in order to keep that muscle mass as we age, because we're losing it, and we lose it quicker with diabetes, to keep that muscle mass, we have to regularly recruit the muscles that we want to keep. And you can do that with resistance training that is moderate to intense. They're doing anything, actually, if you're doing nothing is good. So there are lots of different ways to do resistance training. You can use your own body weight as resistance, which is a really trendy way to do it now. You can use handheld weights or even things you find around your house, water bottles, a 5-pound bag of flour. You can use gym equipment, of course, and machines, and so there are options of different ways of doing it. There's no really right or wrong way to do it. The whole point is you need to be doing it. So with resistance training, it is recommended for everybody you engage at least 2 days per week, but preferably 3, and they should be non-consecutive days. So Monday, Thursday, Saturday, for example. The really important thing about resistance training is that it allows you to increase the size of that glucose muscle tank you have, that storage tank for carbohydrates. And the whole idea for managing diabetes is to keep that tank as large as possible by increasing your muscle mass, and then keeping it partway empty by exercising and using some of it up. So you always have room to store more when you eat anything. So the thing about resistance training is that you can start doing it at home immediately, just using your own body weight as resistance. You can do things like chair crunches, basically sit-ups in your chair. You can do wall push-ups. You can do modified push-ups. You can also do just a simple exercise where you go from sitting to standing. We also call that the getting up off the toilet exercise. These are things that help you manage better as you age, which we all are aging, and then also allows you to maintain some of that muscle mass.